Verified is the fast lane for new patient onboarding. We help telehealth companies to convert more users into valuable patients by making it incredibly fast and easy for patients to access care. We talk about that, just like David said, as one-click onboarding. So the observation here is really quite simple. People hate filling out forms, and there are a lot of forms when it comes to becoming a new patient. So not just talking about personal details like your name, your phone, your address, your birthday, your sex, but often, of course, insurance details like the name of the payer. And worst of all, member ID, where you got to go out, go shuffle through a bunch of cards in your wallet, find your insurance card, figure out which number is the right one. New patients don't want to have to type all of this in. And often in the case of things like payer and member ID, we see that they don't even know exactly what to type, like what number is the right one. If I'm Anthem, is that Blue Cross Blue Shield? It's very confusing. Verified makes it frictionless and pain-free. No more long forms is our mantra. Starting with just a phone number, we magically autofill everything a new patient needs to provide to start receiving care. So address, birthday, name, sex, active health insurance with full eligibility details in seconds from authoritative sources, with the user just sitting there and enjoying it as it fills in. Across many millions of onboarding events that we've powered, our telehealth clients see about a 31% lift in end-to-end conversion, driving tens of millions in net new revenue. So what I want you to think about as I show you the demo is, what would a 31% lift in new patients mean for your business? So let me show you exactly how this works, and you can understand why our clients are seeing this level of lift. So imagine I'm a new user. I've just clicked on some ad, or I've been meaning to get around to scheduling an appointment, and I've just arrived at this new telehealth company, Huli Health. I'm excited to receive care, but I'm doing a million things. I'm cooking dinner on the side. I'm pretty distracted. That's your average user experience here. So all I need to do is put in my phone number. That's it. Put in my phone number here, and I get texted a code. Now, this is really important that I receive this code. This makes sure I can't put in your phone number and see your data. We do a lot of things behind the scenes to make sure that this phone number is trustworthy, hasn't been compromised in any way. And the second that I put that in, we source data from trusted sources in seconds. So this data is coming from credit bureaus, data bureaus, public data records, telcos like your phone carrier, research around the web that we're pulling in. So it's very, very high quality and authoritative. We pull in, as I promised, first name, last name, address, birthday, sex, and we have a bunch of other details behind the scenes, like your employer, your social security number, and so on, that we can use to route and determine what insurance you might be likely to have, and so on, and actually find that insurance. So I go ahead and select my address here. Maybe I want to use a secondary address that's very common for young users or very old users. And now I'm ready to submit. As soon as I do this, we're going to go and find insurance information. This is where Steady comes in. So we're running eligibility checks, a whole bunch of them, to the top payers that we think are likely for the user. And we're discovering insurance for the user in real time. Now, we find in practice that we get about 60 to 80% coverage, depending on the user base, of active insurance. So 60 to 80% of people that are going through automatically, just like that, have their insurance auto-filled for them. No need to go find your card, no need to figure out what number to type in, what pair that you have. You go ahead and submit that, and you, as the telehealth company, have full 271 eligibility information for whatever code you need to look up, and you can go ahead and get them booking or actually paying you for your services. So as you saw, it's about 30 seconds end to end to get all of the information you need to start receiving care. Incredibly, incredibly fast, very high conversion, and patients absolutely love it. I want to show you one other cool thing that's soon in the works. We're constantly reducing friction across the process, and you can actually compose all of these elements. But the coolest new version of this that includes everything that we've released is what you'll see here in just a second. This actually removes the need to look at the phone number as well. Here, we're leveraging our carrier relationships. We've been building out these data relationships that allow us to do this for almost a decade now. So we're leveraging our carrier relationships in this demo video to actually pull the phone number and verify it directly from the user's SIM card. So the user doesn't have to do anything except to consent. So in this demo, the user just says, yep, I'm good to go. We pull the phone number. We pull the personal data. And as soon as they confirm it, just like you saw before, we use that to go look up the insurance information using everything we have on file about the user, both what was displayed on screen and what was not. This is done, of course, fully compliant with all privacy regulations with full user consent end to end. So this is what modern onboarding looks like for telehealth companies. We hope you'll join us. You can try it anytime yourself at verified.inc. Please reach out with any questions. Thanks so much.